Hi, Paul Slackis, Good News Broadcast. I'm speaking to Dr. John Sarno. Hi, Doctor. How are you?
I'm fine, thank you. How are you?
I'm fine, thank you. And I'll
Good.
also say I'm fine, thank you, as a result of you. Dr. Sarno wrote a book called The Healing Back Pain. He's written other things. He's a mind-body medicine pioneer. A professor, make sure I'm saying everything, is a professor of rehabilitation medicine at New York University School of Medicine.
That's exactly right.
An attending physician at Rusk Institute of Rehabilitation Medicine, New York University Medical Center.
Right.
Since 1973, Dr. Sarno has conducted research. Okay, so I went to see Dr. Sarno probably I came back from California and my back hurt. I pushed the scenery for All in the Family when there was a strike. I went to a bunch of orthopedics, I went to osteopaths, I went to a whole bunch of things, and then my brother-in-law, the doctor, said, go see John Sarno. I went to go see Dr. Sarno, and I never had a problem with my back since the 70s. Thank you.
You're welcome.
Tell me what you told me there. Or tell me about your thinking.
Tell you what this is all about. Okay, right.
Please.
Yeah, most people who have pain somewhere and consult a physician, and based on the physician's experience and knowledge, he is inclined to try and identify some sort of structural abnormality. Depending on the location, the pain is in the back, then he'll look at the spine in the vicinity of the pain. Now, this is okay, and this is essential in one sense, because if there's anything really serious going on, an X-ray or an MRI, which absolutely have to be done in order to rule out, it might be 1 in 10,000 or 1 in 50,000, but if you're that one who's got a cancer, you sure want to know it. So most of the time, the MRI will not show anything serious. The big problem, however, with the MRI is it shows other things that I have found to be normal aging changes. Unfortunately, the majority of the medical profession doesn't know that those are normal aging changes, and instead will attribute the patient's symptoms to the change. I'm referring for the most common of these, which is known as a herniated disc. And a disc is a substance, a structure between two spinal bones that was put there by nature to act as a shock absorber primarily. As one gets older, however, it may become less efficient, it may get narrower, and in some cases, in many cases, the constant weight on the thing pushes out some of the material. It's still encased in its own, and that's known as a herniated disc, that material that's pushed out. Now, in my experience, herniated discs do not cause pain. Instead, I find that most people who have this are suffering from a mind-body disorder. In other words, they're getting the pain in the location that is sort of consistent with the herniated disc, but the pain is not due to the herniated disc. Well, now, what in the world are we talking about? A mind-body disorder. What is that? Well, it's very interesting. The way our minds are put together at the present time in evolutionary terms, you understand. This is constantly changing, but it takes many, many thousands of years for changes to occur. But where we are right now is that when the brain becomes aware of certain psychological pressures or difficulties and so on, it sort of automatically tries to avoid having to look at and to deal with those. And so instead, believe it or not, what it does is to create a physical symptom so that your attention will be directed to your body rather than to your mind. Now that's psychosomatic medicine, about which virtually nobody in medicine is aware. And it's rather sad, because invariably when the person complains of pain, they will attribute it to one of these abnormalities. As I said, the commonest is the herniated disc. So that's the story. That's what we're dealing with. And so what I find when people come to see me, they are of course, are under the impression that their herniated disc, for example, is causing their pain. And I tell them, no, it's not. If I find that it's not, if I find that there is evidence of this substitute disorder, then I explain to them what's going on, and they get better. The pain goes away because they now know what it really is. The paradox is that although they're well-meaning, the doctors are contributing to the problem by attributing the pain to the wrong thing. So the patient has it in his mind that he's got a disc problem, and that means the pain will never go away. He has to be informed that the disc is not causing symptoms, and that the pressures in his life and the pressures that he puts on himself, take note of that. That's the most important psychological phenomenon in this whole business. The pressure we put on ourselves to perform well and to be good people turns out to be very nice for society, but it turns out to generate a lot of internal anger. The unconscious mind wants none of this nonsense of having to be nice to people and having to do the right thing. Now that's a summary.
Okay, one a question here that I have, and many years later, this is one of the thoughts that I had, and I became a yoga instructor here, and there's a lot of mind, body, and spirit conversations, which they suggest yoga is being one with your body and spirit. One of the things that I've said, Dr. Sarno, to other people, is something about oxidation, is about oxygen in the body. Is about taking in, and I know with our yoga we do these deep belly breathing, and we take a lot of air in, internal and external. And one of the things that I had sort of thought, and maybe correct me, was that, so I said my side is out, I remember, okay? I threw, some people say I threw the back out, or some people say, so I used to say my side's out, and I'd sit in a control room with ice on my back, I'd be on the floor, I'd do all these things. One of the things that I gained from your conversations, many years later now thinking, was that I thought that what I did was I thought I had some pain in my side, and I depleted the oxygen in that part of my body. So I was in the belief that from my mind, my brain, I could deplete oxygen in parts of my body, which would, in essence, weaken to a degree that part of the body.
No, stop.
Okay.
That's all wrong.
Okay. All right.
Absolutely nothing to do with oxygen supply. And if in this process, what happens is that there's no depletion of oxygen.
Okay.
That the brain, in order to produce pain, will reduce the blood flow just a little bit to the nerves involved, the nerves that serve that part of your back, so that you'll get pain. But that you should totally forget about, because you're not going to do anything about that. You're not going to return the circulation to normal. It will return to normal when you start thinking correctly about what's going on. But you're not going to do it by breathing plain oxygen or doing yoga or doing anything else. This is all a process that has to be done psychologically. It's psychological in origin, and the solution of it is a psychological phenomenon. Your thinking, your understanding. And, of course, in patients with severe problems in their lives, they need to work with a psychologist in order to get the job done. So this has nothing to do with oxygen depletion, in the way that you're putting it. You forget about, you don't ever think about this physically and try to correct it physically. You can only one way to deal with this, and that's psychologically.
Thank you.
Sorry about that.
No, hey, look, it's a new day.
Good.
It's a new day. I have, it's all about the forward motion. It's all about the journey.
Good.
And I only commend and thank you for
Right.
hearing other thoughts, because I've mentioned
Oh,
this
sure.
to other people, of course, and I'm glad. So I'm so happy we've had this conversation. So now I see you have a website. One other thing. I mean, you that I remember people doing, and I don't know if they still do. They took out orthotics out of their shoes. They had back pillows out of there. They threw them away.
Sure.
It was sort of I've compared. How you gonna feel about this one? I kind of sort of compared it to a revival meeting. So,
yeah. Okay.
Okay. So
All right.
where people were like, tossing the.
I've seen the light. Hallelujah.
They're throwing this thing on their neck, this thing in their back, and this thing in their shoes. So another concept. Yes, no, but it goes back to the basic principle of what you just said.
Mm-hmm.
Okay, so there's no
What?
difference. Okay,
Oh, yeah.
So in other words, I mean, these let's call them devices
Yes.
that then people go and use.
Yes.
You're thinking in that regard.
They can only perpetuate the problem, because what they do is keep the person's attention on the body and on what the body is doing. And what I tell my patients is, if you want to get over this, you got to get totally out of the physical ballpark and totally into the psychology ballpark. Now, people understand ballparks, and that's probably a good way to do it. And there's no 1 foot in each one, okay? You got to get totally out of it. You got to say, there is nothing structurally wrong with my back. I have a herniated disc. That's normal aging change. I've got this, it's out of line, and the doctors told me that's normal aging changes. There is nothing structurally wrong with my back. As long as you continue, as a person continues, to think that there is even a little bit, only one rotten apple will spoil the whole barrel, they're not going to get better. They've got to get out of the physical ballpark totally.
So in my knee now, the softening of the cartilage,
The meniscus.
right?
Yeah.
And possibly a little blister on the kneecap, and some pain on the inside of my leg. How to proceed?
The pain on the inside of your leg, almost certainly. Now, obviously, I can't say. So, under the circumstances, I'd have to see the patient examine, get the history of the pain, where, when, what the pattern is, and so on.
Sure.
But such a thing can certainly be, and probably in the majority of patients, a manifestation of the TMS. But each one, has to be looked at individually.
That's TMS
But
you did mention.
statistically, I would say that probably 99 out of 100 are going to be TMS, and 1 out of 100 will be some structural abnormality.
Okay, TMS stands for?
Oh, tension myoneural syndrome, which is what I've written about.
Okay, all right, and that's the technical term.
Yeah.
Okay, all right, scientific term, let's say. Okay, all right, it's all good. I appreciate your time here,
Okay.
and I could talk longer, but the people like the shorter, right to the point, and if there's anybody who I've ever met who's right to the point, it's Dr. Sarno. So last question for you, Dr. Sarno.
Yes.
What's good news for you?
What's good news?
Yeah, what's good news for you?
Well, my grandson's good news. Is that the kind of thing you had in mind?
That is my good news also. Not your grandson too is good news, but my grandson and granddaughter is the same good news as.
All right, so let's say our grandchildren are the good news.
I love you, Dr. Sarno. You're a great man. Thank you so much for taking time.
Okay.
Bye-bye.
Bye-bye.